Michigan ranks among the most obese states in our country. Statistics show more than 30% of our population falls into that category.
The implications to your health are dangerous, even deadly, and there are some great options. Today, Dr. Jon Schram, a bariatric surgeon from Spectrum Health Medical Group, is here today to talk about those surgical options. Dr. Schram, we know this is a topic that a lot of people are wrestling around with. Almost a third of our population are considered obese.
Yeah, thank you, Terry and Rachel, for having me. Yeah, it turns out actually there's probably 10 million people in the United States who qualify for weight loss surgery who are considered morbidly obese. And so it's becoming more and more of a major problem in the United States today, but fortunately we have some good options for people who suffer from really serious disease.
So I guess we look at it and we say, who is best suited for surgery like this?
Yeah, I think for people who suffer from serious obesity, what we call morbid obesity, those people who have a body mass index greater than 40, at least 100 pounds over body weight, or those people who are like 75 pounds overweight, have a body mass index of 35, who suffer from serious medical illnesses like diabetes and hypertension and sleep apnea. Those people qualify for the operation by most insurance companies and are the ones who are ideally suited to undergo a surgical weight loss.
Because we're not talking just about appearance here, although of course that's a part of it. We're really talking about some really serious, almost deadly health concerns.
Yeah, the problems that serious obese patients face are significant. I mean, the early mortality rates for diabetes, for hypertension, for heart disease are significant. And what the studies have shown is that people who undergo weight loss surgery, who successfully lose weight, get rid of their diabetes 84% of the time, get rid of their hypertension about 50% of the time, get rid of their coronary artery disease, their high cholesterol. And so we make really some dramatic changes in their health, and every study that's been done has shown that people actually live a lot longer following weight loss surgery.
And this is a process. I mean, it's not something that happens right away once you make that decision. And also, everybody is different too, so the surgeries are different depending on what's best for that individual.
Yeah, what I like to do is try to tailor the operation for the patient, to try to have them figure out exactly why they're in my office, and then to determine based on what issues they're facing, which operation is best for them. For some people, it may be that they just plain eat too much, and then a restrictive operation may be a better operation for them, a band or a gastric sleeve operation. But for those patients who struggle not only with volume but with bad choices, they may need an operation that actually talks to them or changes their way of life, their lifestyle a little bit. And so we have operations that allow us to be able to tailor, you know, to what their needs are.
So walk us through a couple of those. The first, I think, is one maybe that is maybe the most invasive.
Yeah, the gold standard really in the United States for weight loss surgery has always been the Roux-en-Y gastric bypass, at least for the last 10 years. I mean, we started out doing them through a major incision, required a long convalescence. Now we do these operations through the laparoscope. They usually take less than an hour to do. Most patients stay in the hospital for only a day or two and are back to fairly normal activities within a week or two of surgery. But the bypass does bring about a transformative change in their lifestyle. They can no longer eat simple sugars. They can't eat a lot of fatty foods. So it really changes their lifestyle. It makes them aware and makes them plan a little bit more carefully what they're going to eat so that they don't get sick from eating the wrong types of things.
And the surgeries take place at Zeeland Hospital, where
Yes.
you choose to go with.
Yeah, we just opened up a new bariatric program on the Lake Shore in conjunction with Spectrum Health. And so we're doing the operations at a brand new facility at the Spectrum campus at Zeeland Hospital.
Yeah, and it is good to know that that isn't the only surgery that's available. There are a couple others too that you also perform regularly.
One of the more popular operations now is an operation we call laparoscopic sleeve gastrectomy, where we remove about 85% of the stomach. And it turns out the sleeve gastrectomy is just about as effective long term as a gastric bypass operation, but doesn't require the changes in lifestyle that are so dramatic with the bypass surgery. So many patients are opting now for a sleeve gastrectomy, which also can be done with a laparoscope. It's done in less than an hour, requires just an overnight stay in the hospital, and most people are back to normal activities within a week or two of surgery.
And as you follow people through this process, are you finding that it's like you've cured them from cancer? It literally, is it transforming their whole lives?
It's a great way to say that. I've been doing this for over 10 years, and the stories I could tell are just amazing. Of how people's lives have been changed, and I remember stories of guys crying in my office because they were finally able to go hunting with their sons.
Wow.
And grandparents being able to get down on the floor and play with their kids again. And I mean, it's just amazing the lifestyle changes that occur. But I think more importantly, we're curing diabetes, which nobody else is doing. We're taking people off their antihypertensive medications. We're fixing gastroesophageal reflux disease. We're just doing so much to improve the health of the patient.
Okay, so we have some contact information here, website, and a number that people can call. It's great, this is a process. I know that you have different systems in place to help people because this is a 180 for a lot of people changing their lives. And the first step would be to give a call or to go online and learn more about it, right?
Absolutely. There's great information on the websites. We're happy to have patients call our office and come in for a visit. Happy to talk to them about how they can really see a change in their life.
New year, new life.
Absolutely.
You like that in insurance companies, a lot of them will cover this now, correct?
Yeah.
Well, because this is such a transformation in their health, insurance companies are realizing they actually save money by allowing their patients to go through this process. So insurance companies are more and more commonly now paying for this operation.
Yeah. Well, thank you, Dr. Schram. We appreciate it.
Thank you so much.
Quite an
My pleasure.
opportunity.
Thank you.
We'll be right back.
Great information.
This is 8 West.